Anesthesia in small ruminants. For general anesthesia, you can use xylazine or metomidine. However, xylazine is unpredictable. It can cause bradycardia and respiratory depression. Metomidine is much more predictable and it's better. For induction and maintenance, you can use ketamine. You can also use alprazolam. It's an inhalational anesthesia and it's very safe. It has a short induction. In the university, they use xylazine for induction and they give around 0.3 mils per 60 kilogram animal. This is for sedation. And for induction and maintenance, they use zolapam and tylatum. These are given intravenously and you give 5.2 milliliters for every 60 kilograms. When doing an epidural, you can do a high caudal or a lumbosacral. Low caudal is not really done. For the high caudal epidural, it's done in a rectal, cervical, or uterine prolapse. It's done when the sheep is standing. You clip over the head of the tail and you disinfect. And then you palpate the sacrococcygeal space by lifting the tail. And then you insert the needle at around a 10 to 20 degrees angle. And you can inject 2% lidocaine or have lidocaine and xylazine together. In around a 60 kilogram to 80 kilogram sheep, you need 2 mils of lidocaine and 0.25 mils of xylazine. And then you must wait 10 minutes. For a lumbosacral epidural, this is done when there's a vasectomy, a C-section, a vaginal prolapse, or any hind limb surgery. The animal must be in sternal recumbency and you prepare the area. Palpate the lumbosacral space and insert the needle at a 5 to 10 degree angle caudally. Go into the subarachnoid space and inject body-warm lidocaine 2%, and in an 80 kilogram sheep, this would be around 12 mils. When doing a regional nerve block, the max you can give is 6 mg per kilogram. So if a small ruminant is around 6 kg, you can only give 2 mils. And if a sheep is around 60 kilograms, you can only give 20 mils. The most common one is the distal lumbar paravertebral nerve block. And in the distal limb, it's done when there's a distal limb vascular infusion. You can also do an corneal nerve block for the horns and an auriculopalpable nerve block for the eyes. And for the teeth, you can do a ring block, an inverted V block, and a teeth cistern infusion. When doing a distal limb vascular infusion, this is done for digit amputation and you also give NSAIDs. Put a rubber tourniquet on the hoof or the carpus and then localize the vena saphana lateralis and then inject with a 20 or 21G needle and then draw around 5 to 10 milliliters of blood and then inject around 2% lidocaine and then wait 2 minutes.